I'm with Dr. Ira Gelb, sitting on his examining table. Dr. Gelb is a sports medicine specialist specializing in the knee and the shoulder, and he's with Potomac Valley Orthopedic Associates. Dr. Gelb, so many knee injuries we hear about with young athletes. How can we avoid them?
Well, we can reduce the risk of sports injuries. We're not going to be able to eliminate all of them. Number one, proper preparation for the sport through training, being in shape, stretching before and after sports, and being generally prepared and physically fit, wearing proper shoe wear, being aware of the surface can have an effect, although that is not necessarily something they can control. There are certain things out of their control, getting a direct hit on their knee or certain circumstances of a traumatic injury that we can't control.
What do you see in the practice? Because I know you have a lot of student high school athletes. What are the major knee injuries that you see?
Well, I think the number one major injury that affects someone's sports career, or at least temporarily does, would be the ACL injury. I see that in both young men and women, more commonly in women. And that obviously is an injury that will typically end a season. And nowadays, fortunately, we can reconstruct the ACL and get people back on the field. But that's the most severe typical injury. I see meniscus tears are also another common injury. I see a lot of overuse injuries, tendinitis injuries, things that...
Even in young athletes?
Yes, see tendinitis. We'll occasionally see a tendon rupture, which is not common in the young athlete, but seen patella tendon ruptures, very occasionally an Achilles tendon rupture.
What is an ACL injury?
So the ACL is a primary stabilizer of the knee. And an ACL injury usually refers to a tear of the ACL. 90% of ACL injuries are complete tears. There is about 10% that can be partial tears, but most of those will progress to a full tear. And there's basically no function in that ACL after it's been torn.
Right. And the only way to correct that is surgical procedure?
The only way to actually correct the ACL is surgically. There is non-surgical treatment, but in the high school athlete who wants to continue with sports, surgery is really the only effective way to treat it and to protect the knee from further injury.
Dr. Gelb, why are we seeing more young women sustain this injury?
Yeah, that's something we've seen. There are a lot of factors that predispose women more to these ACL injuries. Some of it is controversial, such as being a woman and the menstrual cycle has been related to ACL injuries. But clearly the women have a different anatomy. Their legs are typically at a different angle, which puts a different type of stress on the ACL. Women have been shown to use their muscles differently than men. Their quadriceps and their hamstrings are used differently in jumping and landing, and that can be actually changed through training. Women tend to have their anatomy is such that their notch, which is the tunnel through which the ACL sits in this tunnel, it's a little narrower in women and can act as a guillotine for the ACL. So there's various structural reasons, there's functional, physiologic reasons.
As a parent, okay, of say a young female athlete, when you say proper stretching or proper technique, is there something that a parent should be looking for?
Well, I think everyone should warm up before they participate in a sport. They should probably stretch their hamstrings, their quadriceps, calves. That's before each event. But they should be regularly stretching, and they should be also preparing strength-wise. Their muscles need to be strong, their calf muscles, their quadriceps, their hamstrings even mostly, to prevent ACL injuries. That's not something you do, obviously, at the time of the event. Lastly, there is, especially in women, something called plyometric jump training. And that has been shown to reduce the risk of ACL injury.
What is that?
Well, it's a technique where there are lots of different programs. There is a program put out by Cincinnati Sports Medicine that actually we sent 2 of our therapists to train with them so they can teach this. And it's a program where the girls are taken through certain techniques of jumping, as well as sort of rigorous exercise program, strengthening their muscles and training their muscles to contract properly. What has been found is that women contract their quadriceps without a co-contraction of their hamstrings the way men do. And the hamstring actually protects the ACL. So by training someone to contract both muscles together through repetition, that can actually protect your ACL.
Fascinating. Now, the big question is, and I'm sure it's a tough answer because a lot of high schools are going to turf fields. You, as orthopedics, what do you see the injuries from more, turf or grass?
Well, I do see more injuries on turf, but I think there are more turf fields, so I can't tell you that I can make a scientific pronouncement that the turf is causing the injuries. But definitely, it would seem that way, but once again, I don't have a controlled study to prove that.
Right, and that is you're right. With more schools, it's a difficult whether to say the turf or the grass is causing the injury.
Have proper shoe wear there. I think it's important to wear proper shoes for the surface.
Different shoes for grass and turf.
Yeah.
Are coaches aware of that, or are the schools doing that?
I'm not sure if everyone's doing that, but
you would recommend that as a doctor.
It's something worth considering.
What is the difference of the shoe? Just
honestly, I'm not sure the whole specifics of the shoe, but there are specific turf shoes.
Because I know the football players, you always see them changing, with weather and the professionals. Well, that's fascinating, and I really appreciate, Dr. Gelb, your time for the knee injuries. We hear about it all the time, and hopefully this will help some parents and student athletes. Thank you.
Great.